Welcome back to Take Two. I'm Dina Bair. Tomorrow is World Menopause Day, and for many, it's a dark and discouraging time. Today, we're going to have a roundtable to discuss the struggles of midlife body changes. OBGYN, Dr. Susan Scanlon, you deal a lot with this issue.
Yes.
We had people call us after our original story on menopause, and they said, I've talked to my doctor. I asked for a blood test to see where I am, and they said, oh, you don't need that. Just go through it. What would you say? They went home defeated.
Oh.
This is their physician.
Sure, sure. Well, when people go into OBGYN, many of them are attracted to the world of obstetrics. That's what really drew them in, is delivering those babies. So the area of gynecology has many aspects to it: endometriosis, it has PCOS, it has pelvic pain, and then there's an area of menopause. So not every doctor is completely passionate on all aspects of the field, because it's such a large field and so much information to know. So my advice to someone is if their doctor isn't comfortable talking about menopause, doesn't really understand all the treatment options that are available, is uncomfortable prescribing hormone therapy for a patient, I would encourage them to maybe seek out a doctor who is comfortable. There's an entire area of experts in menopause. For example, the Menopause Society. I'm a certified menopause practitioner through the Menopause Society for over 15 years. And so I'm truly passionate about it, completely comfortable with all those topics. So they may maintain a relationship with their doctor for their regular gynecologic care, but then I would encourage them to seek out a physician who's comfortable with the topics of menopause.
And I want to talk about some of those things a little further, but first I want to get to Lisa Bates. You're a nurse, and now you're a personal trainer, and I'm sure you have people coming to you that say, I'm doing exactly what I was doing before, but all of a sudden I hit this age, and I've got this tire around my midsection. What am I doing wrong?
Yeah, and that's a big complaint. One is you have to exercise differently. The high-intensity cardio without weight training is just not a thing anymore. In menopause, your cortisol levels are already sky high, and exercise induces cortisol. So you have to work out differently. Strength training is a big thing. Bone loss is a huge thing. So any kind of weight-bearing, weights, it doesn't have to be heavy. It doesn't have to be every day, but it has to be consistent.
You all are so educated about this, but our mothers, our grandmothers never told us about it, never talked about it, and I would venture to guess that even a lot of girlfriends are not having this conversation. So what do we do, ladies?
Menopalooza.
Let me start there.
I think you find a community of women that are willing to talk about it, or you find a doctor. Like, I had an amazing OB, to your point. I brought 2 beautiful babies into the world, but when I went to her and said, I just don't feel good, and she told me I was healthy, that's when I knew I had to take my own health into my own hands and find a private concierge doctor that would take it a step further and really, dive deeper into my blood work, really take the time to understand my health and understand why I felt tired all the time. I look healthy on paper, but I didn't feel good. And I think it's really important to advocate for yourself and find somebody that's willing to go on that journey with you.
And when you talk about the blood work, I think there are a lot of women out there who say, I don't know if I'm in menopause. How do I actually know? First, what are the symptoms beyond the hot flashes? We all know about the hot flashes, but there are so many other things: dry mouth, dental problems.
Oh, sure.
What are the symptoms that women should be looking out for?
Well, there's a large variety. It affects every aspect of your body when you go into menopause, because there's estrogen and progesterone receptors throughout your entire body. So most commonly when women come in to discuss it is when they formerly felt like I was completely in charge of my life, I could manage the household, I could multitask, I was on top of my job, my family, and now I can't keep track of anything, and I'm crying all the time, I'm in a meeting, I'm sweating, I've got to leave, and my period's abnormal, or, I just can't focus. So they'll seek out care with their doctor. So I think if you're experiencing symptoms that don't make sense to you, that you're not able to maintain the quality of life that you are used to or that you want to have, then I would speak to your doctor. And odds have it, if you're in that range, the average age of perimenopause begins around age 45, 46. But we've all seen anyone who takes care of enough menopause patients, you see it start in their early 40s for some women. And then The average age of completion of menopause is 51. So it's about a 5-year transition for most women. You don't necessarily have to do hormone labs initially, because the definition of menopause is 1 year without a period. So when you know 1 year without a period, you know that you're done and you've now entered that postmenopausal time frame. But hormone levels along the way definitely can help some patients. For example, those who've had a hysterectomy, how would they know when they're finished? Or someone who's had an endometrial ablation, or someone who's gone through breast cancer and had chemo, and that altered their hormones. So I think patients sometimes need hormones to give them advice about where to go, and then the doctor can guide them about what their next steps are.
Pam and Julie, I know that you really advocate for women to speak up, but beyond the OBGYN, who are the other people that you tell ladies to go to get that level of support and to get the help?
Well, there's actually really a challenge around the United States regarding access, right? And not only are we talking about education and the education of woman to woman sharing their stories, but also there really aren't enough menopause providers in the United States. And I'm not sure what the number is, but I think it's one menopause provider for every 30,000 women. It may be 35,000. So, right? So it is really a challenge. So that's part of why we do what we do, because there is access to education. Social media isn't perfect, but it is elevating the conversation. So women are learning more and they're asking more. And there have been a lot of books written in the past few years, including ours, but you know, that are really tremendous and offering a lot of information that's accurate, so that they are actually going to their physicians, seeking out physicians like this wonderful doctor here, thank heaven, right? So that you know, taking care of women. Right? We need more, and as Pam always talks about, there's limited education.
Very
right?
limited education, yeah. So as women, I think, you know, we learn a lot about puberty, we know a lot about pregnancy, but then it's like we kind of fall off a cliff, and there's really very little information available after that. So,
I don't think I've ever done an interview where so many of us are shaking our heads.
Yes. We're just always like, yes.
Well, after my hysterectomy, that was done by a woman, I was like, what is going on with me? And she goes, just eat less and move more. And I'm like, that is not a good answer. You are fired. And so I just like kind of was like, all right, this is my life now. So this is what happens. And then I started a prep for a bodybuilding contest. And then I was like, all right, this is like, it helped, but it wasn't the answer. And I had to go find a concierge doctor to get my hormones.
I could add to that. So I think your point about not having enough access, that's true. So just for the menopause, I was asked to speak at one of the M Factor events with cardiologists. And I learned at that event that there's only 1,800 certified menopause practitioners in the United States, which I thought was a small amount. And then in the state of Illinois, for physicians, there's only 60 at this time. So I'm sure with the growing movement and more education, more people will take the exam to become a certified menopause practitioner. But that just shows you the limited number of people who have devoted their time to the education on that. And then with regards to medical school and residency, approximately 31%, 32% even have any part of their curriculum involving menopause. My youngest child is in medical school now at Emory, and she told me, she's in her first year, that they actually have incorporated menopause into their curriculum. So very happy to hear about that.
Have any of you had the experience where you try to talk to someone about it and they're like, no, I don't want to talk about this?
Yes. Well, I mean, perimenopause, I had the perfect storm of postpartum and perimenopause,
oh
right?
My.
And ended up with an autoimmune challenge that was undiagnosed, and never was it mentioned. So I'm in my 60s, never was it mentioned that I was in perimenopause. And there was no treatment available, right, because of the 2002 study. So I think that there's just, it's multifactorial, you know, so.
We are all growing, and we want this conversation to continue clearly. Words of advice for anyone?
be your own advocate. If someone tells you no, they're probably the wrong person for you.
And I also want to say midlife, I see it as a window into bigger and better things, right? And I think more companies are supporting women in the workplace. There are more initiatives for that. And I think women are making choices on their own behalf, right? You just had this transition a year and a half ago. And I think so women can say, you know what, let's do something different. I want to create something bigger and better for my life.
Yeah, it's never too late to start something new.
You ladies are a force, and you'll be helping so many others. Thanks for getting together and talking about this with me.
Thank you.
Thank you
you.
so much.